by Amy E. Gray from Iowa Western Community College. Achondroplasia is a disease that affects many people in different ways. The name itself implies absent cartilage formation. It is an interesting disorder with multiple causes. It requires multiple secondary treatments as the gene mutation is incurable. It affects 10,000 people in the U.S. and about 1 in 40,000 people worldwide, making it the most common skeletal dysplasia. Achondroplasia is a mutation of the gene fibroblast growth factor receptors that affects bone growth and can either be spontaneous or genetic. Some dysplasias affect bones like the skull, spine, and extremities. Achondroplasia is the most common form of dwarfism. According to the Children's Hospital of Philadelphia, the average height of an adult with achondroplasia is 4 feet 4 inches in men and 4 feet 1 inch in women. They rarely reach 5 feet. It causes disproportional bone growth due to genetic mutation telling the body not to convert cartilage to bone. There are several different types of achondroplasia that affect different parts of the bone or cartilage and are noticeable at birth. The most common type affects all of the long bones. It affects males and females equally. Many cases result from a random new mutation, and some of the random cases having parents greater than 36 years old with no family history. There is a 1 in 430 chance that if one child is affected, then a second child may have achondroplasia. If it is genetic, it only needs one parent to carry the deficit. If the parent has achondroplasia, then there's a 50% likelihood that a child will have it as well. If both parents carry the gene, there's a 50% chance that their children will have the mutated gene and a 25% chance the child will be healthy with no genetic mutations, and a 25% probability that the child will have a fatal form of achondroplasia. It is diagnosed with physical exams, X-rays, and can be confirmed with genetic testing if needed. Children with achondroplasia may have several different health problems. At birth, the provider and parents may notice a significantly below average length, shorter arms and legs, especially the upper arms and thighs, shorter fingers, and the middle fingers may point away from each other. Head may be too large for the body, big, well-pronounced forehead, and underdeveloped area of the face between the forehead and the upper jaw. They may also have health problems like decreased muscle tone, apnea, hydrocephalus, or spinal stenosis. As they age, they may develop issues with bending the elbows, obesity, bowed legs, kyphosis or lordosis, recurrent ear infections, or new or more severe spinal stenosis. This mutation can change overall intelligence or lifespan. The most common cause of death is brainstem compression in younger children than 4, and death is sudden. By ages 5 to 24 years, the central nervous system and respiratory abnormalities are the most common cause of death. The older the individual gets, then the risk of death from cardiac problems is more likely. Other health problems include spinal deformities like scoliosis, obesity, hydrocephaly, obstructive and restrictive respiratory problems, recurring otitis media that may cause hearing loss, neurologic complications due to cervicomedullary compression, which can cause cyanotic episodes, hypotonic apnea, and feeding issues, and even death. There are reports that state there is an association between Down syndrome and achondroplasia. The studies calculated the chance of this happening is one birth in 8 years' time. Many people go on to lead productive lives, including raising family and having careers. There are many forms of treatments, but none specific to achondroplasia. The provider will treat any problems as they arise. Ear infections are treated with antibiotics, and surgery may be required for severe cases of spinal stenosis. Some doctors choose to use bone lengthening, and some doctors treat the patients as the child grows with growth hormones, but there's no proof that this works. The list of nursing diagnoses can be very long. Some include activity intolerance due to acute and chronic pain in the joints and spine. The patient may have altered self-esteem from either being bullied or from being different or just being self-conscious. They may become defensive, which may lead to social isolation, and it is not uncommon for people to want to fit in. With things like activity intolerance, chronic pain, and decreased self-esteem, it can lead to depression since there's no cure. The Journal of Neurosurgery Pediatrics looked at several different surgical procedures for the patients with varying spinal deformities and reported that there are some improvement postoperatively with the patient's self-esteem and depression. The person or parent of the child with achondroplasia needs to be educated about different support groups that are available. This can be an excellent coping mechanism. There are several groups that help promote and encourage people with less than average height to be able to participate in the Olympics. Some people may even gain encouragement from reality TV. The provider can also assist with finding adaptive equipment for home, work, and their vehicles. The best thing, though, is to encourage them to continue supportive care for each diagnosis, and they will be able to live a happy, healthy life.